is we're going to be recording. If that's okay with y'all, and we send that out with the chat notes so that folks who are unable to attend can catch up as they would like to with their own schedules. So, but we really appreciate people coming, because if we did that and nobody came, then there wouldn't be anything for people to catch up with. So we appreciate it. I think we have a few new faces this week. So just to give a little bit of background, I'm Margaret Fire-Robin, and I put down by me Family Promise at Bristol and Bristol's Promise, abbreviations. And we started doing these meetings in March of 2020. We did them weekly, and it was trying to keep up with all the changes with COVID. We went to every other week after maybe almost a year. And then we've gone to once a month, and we coordinate with Bristol Coalition, which is focused more on Bristol, Virginia. This one is both Tennessee and Virginia. And Bristol Coalition meets the second Tuesday from 12 to 1:30. They've also gone back to in-person and sometimes given the virtual option to join. So far we've stayed with just the virtual Zoom, and at this point that's what we plan on continuing. So appreciate everybody being here. And our format, sometimes we have programs, and we do have one today, so we will do that, and then we will go around and have updates from folks. And I know there's some folks here for it's great to be able to share. There's folks here with resources. There's folks looking for resources and referrals. So it hopefully will be a good time together. Please use the chat as you would like to add your contact information, any updates that you can put in writing, plus we can, you'll have your turn also to do it verbally. So use the chat as you would like to do for communicating as well. So with that, I think, let me be sure I covered everything I wanted to. So with that, today we wanted for Family Promise at Bristol to give an update on Day Center program that our community has been working toward for quite some time. So Dottie Havlick is the board president. Melissa, you got to let me share screen. You took host, so I've got to be either the, yeah. Thank you. Yes, so Dottie Havlick is the Family Promise board president, and she is going to share today, and hopefully that is showing up Family Promise. And then I'm going to start with the slideshow, hopefully. Does that work for everybody? Say yes, Dottie.
Yes, it works for me.
Great. All right. So, and if everybody could go ahead and mute as well, that would be fantastic. So, and then unmute later when you're ready to do that. So, all right, Dottie.
Okay. Hi, I'm Dottie Havlick. And as Margaret said, I'm the president of the board of directors of Family Promise of Bristol. And we have been working long and hard. And before we were working with it, lots of people in the community were working to get a day center open. And we call our effort a place to be, so that people know that they can just come and hang out. But we do have services that we offer them, and we've been open. This is our second week, so it's been really nice. We have focused on 4 areas of housing: homeless prevention, street outreach, emergency shelter, and rapid rehousing. And the difference between homeless prevention and rapid rehousing is that homeless prevention is keeping people in their homes, and rapid rehousing is taking people who have no homes and putting them in homes. So, and outreach is just that, trying to go out into the community and meet the people and let them know that we have services to help them. So we had, for the past year and a half, COVID ESG grant. And so we did that. It was $500,000. And then they had some money that was not spent, so we got 40,000 more rapid rehousing dollars, and we just are completing that grant now. So not content to sit around, we opened a day center. So we have funding for a small amount of homeless prevention funds through Family Promise and the United Way of Bristol through National Family Promise. So we're looking for additional funding for prevention and rapid rehousing so that the people who are in the shelters and who come to the day services, we have the funds to place them in permanent housing if that's what they would like to do. So we're going to learn about more funds in October, and but meanwhile we are simply doing our day services. So 5 years ago, the community really got together and decided to explore having a day center for the unhoused population of Bristol. And they worked hard and they got a lot of stuff done, but there was nobody to take over a 501c3 role. So they, Family Promise accepted that role as the 501c3 umbrella for the day services programs. And we looked at, oh golly, I don't know, 15, 20 sites. And there were barriers to everything. Zoning is a big issue. How accessible it is to people without homes, to all these sites that were too expensive or too big or too small. And so we've began partnering with the Salvation Army to talk about joining forces to have a day center at their location, but run by Family Promise of Bristol. And so we began that service last week. It's open Tuesdays, Wednesdays, and Thursdays from 9 a.m. to 3 p.m. We have 2 case managers. We have showers. We have laundry services. They do their own laundry. We have snacks and lunch. We help process their mail. The Salvation Army address, but Family Promise keeps track of it for the folks. We have computers and phone charging and just friendly faces. We help with housing resources, helping people find homes if they want us to. We have helped them make application for benefits and IDs. IDs are very important. If you don't have an ID, you can't take advantage of the many services in the community for the most part. We help them get food. We have health information. We have partners who provide health information and exams, employment information, and of course, again, it's on the bottom, but it's maybe one of the most important is trained case managers. So here's our staff. Larissa Copley has been an AmeriCorps through ARCH, which is the Appalachian Regional Coalition on Homelessness. She's been our intake coordinator, and now we've kind of moved our offices mostly to the day center. So she's the first person everybody sees when they walk in the door, unless she's taking a break and somebody's filling in for her. Karen George is our program monitor. We do use HMIS database, and she's that administrator. We also use Unite Us. It is a duplication of effort, but we believe we are required by the state to have HMIS, and we believe that Unite Us, provided by Ballot, is very important to our community, and we encourage everybody to get right on there with us so that we can coordinate our services. Our main case manager is Sam Ferguson. Brianna Baker is our assistant case manager. We have another part-time AmeriCorps who is Crystal Curtis, and she serves with us at A Place to Be, but we also cooperate with United Methodist with Proverbs 3:27 mission. Our volunteer hours that we log are more than 30 hours a week, and we're getting new volunteers every day. They can go on our website at familypromiseofbristol.org and get an application. And but we do background checks because we do work with vulnerable populations. So our main partner right now is the Salvation Army. They allow us to rent their building. We share costs with them for utilities because we have increased their utility usage. And Proverbs 3:27 mission at Hunt Memorial. They're open Mondays and Fridays, and we're open in the middle of the week. Haven of Rest offers shelter services. Calvary Baptist Day services are offered at Anchor Baptist as well. We work with the Envision Center, with Lynn Pinnell and her staff with workforce and things, Frontier Health, Ballard Community Health Navigators, Sullivan County Anti-Drug Coalition, Bristol Public Library, and they will be doing more as we get more established. Veteran Services, Crossroad Medical Mission, is not very far, but we can provide transportation. We had a client we thought might have a medical problem that we used, the Crossroads treated that person this week, and Healing Hands always were ready to cooperate with us. All of you here, we hope, are our additional partners, because we have our friends that come to us on Tuesday, Wednesday, and Thursday have lots and lots of needs that a lot of you can help us with, and we really want to work with all of you who can help our folks that come to us. And you can see a list there. A day in the life. We're just now getting used to what a day in the life might be because we've only been there 2 weeks. But after 5 days of service, we've had 30 people a day. So, and that is a little bit of everybody. We've had some kids, we've had women, we have men, we have people who are looking for jobs, and people who are who have not been homeless very long, people who are what people would say have lived on the street for years. So many different races. So you all know, but a lot of people don't, that people who are unhoused are all kinds of people. A lot of people have this image of some white guy carrying a big bag, but it's everybody, and you all know that, and you all could help us get the word out about that too. About half of the people who come have requested case management, and that is very encouraging because we haven't been open that long for them to get used to us, but the numbers are increasing. They can tell we care about them and we want to help them. And so they are asking us for case management services. We have the laundry, the showers, food, a place to put their stuff. We're trying to talk about where we can put lockers. Right now, we're serving snacks, coffee, water, bag lunches. We're hoping to get hot lunches soon. So what do we need? We need volunteers. If you haven't been to the Salvation Army, you come in downstairs. So we have a staff person that's downstairs checking people in, seeing if they need to sign up for showers and laundry services. But then they come upstairs and we have what I guess is a cafeteria, is our day room, but the services, the laundry and the showers are in the dormitories. So you can't see the dormitories for here. So we have to have staff and volunteers who take the people around and show them where to go and what to do. So we need donations of snacks, new underwear and socks, gently used clothing of all sizes so that people can have something to put on after they take a shower and while they're washing their clothes. Toiletries, backpacks. We have a complete list available. If you want to find out from us, we have it. We can email it to you. Our offices are at 100 Ash Street, the first floor of Edgemont Towers, in partnership with Bristol, Tennessee Housing. And we share that space and a lot of good advice from Bristol's Promise.
Okay, so
if you would have any questions, or Margaret, you want to add something?
I think taking anybody's questions. Also, we have folks on here. Brian, if you want to add anything for what you're seeing, and folks who are serving and Envision Center folks, we do not have all the services scheduled on site yet. Some people we have talked with, but have not. Some people aren't ready, and also we need to get our routine down a little bit, but hoping that will happen in the next 3 to 4 weeks, that we'll start having those services on site. Yeah, and the other is we are closed Thursday. A week ago, Friday, Salvation Army put in COVID protocols with the numbers going up. And the day center, we had somebody who is a guest at Salvation Army who tested positive on Wednesday. And after consulting and thinking through, the Salvation Army is restricting to no more new guests. And we decided it'd be wise for us to stop our services on Thursday and start back next week. So for protecting our staff from COVID, as well as seeing how many end up testing positive. So we did not offer services on Thursday. I was hoping to hear whether Hunt was open today or not, but I had not heard. So if somebody knows that would be great to know. I think I was going to say something else, but anyway, yeah. So Brian, do you want to say anything?
No, I'm just glad to hear that the day center is open at this point. I think it's going to be a big help to a lot of people. We are continuing to see a lot of people come to evening meal at this point. As far as we had been in the 50s and 60s. We dropped back at the beginning of the month, the 40s and 50s. We just served 72 last night's evening meal. So there's still a lot of usage out there for that. We're also seeing a really big influx of people to our food pantry at this point. So ever since probably about March or so, it's really, really picked up. So tremendous amount of need out there at the moment.
Yeah, and right before, I think just this past week, Salvation Army filled up. They were not full, but right before COVID, they're full. So that means everybody there. Right. So Yeah, and we do want, so this is the first kind of official. We have not done any press. We haven't, because we felt like we wanted to be a soft opening and learn a little bit for getting some of the wrinkles out. So this is kind of our official kickoff with you all, our partners, so that y'all know what is going on. Also, the Calvary Baptist Day Center, they offer Tuesday, Wednesday, Thursday also. And Brian, I think it also depends on who's serving what food. I'd say your food is very good on the evening meal. So folks are going to appreciate that. Same thing for lunch. Ours is a little snack bag. And on Tuesdays and Thursdays, Fellowship Chapel serves a hot meal. We're hoping to work with Kevin France and see what we can do for cooperating sometime in the future with that. But I'm sure their food is a lot better than sandwich and chips in a paper bag. But so anyway, what else, Brian?
That's probably all that I really have to offer right now. So
okay. And Brian, for those, he does Haven Arrest, which is, we have two shelters, overnight shelters in Bristol, Salvation Army and Haven Arrest. And y'all also work with folks for job skills and everything else, right?
yes, ma'am.
Yeah, and as well as Salvation Army does, and they have Pathways of Hope with it. Shannon Dell works with families to get back on their feet. So trying to work all together. And I don't know if anybody wants to, who's the best person to talk about the case management meetings? Andrea, do you want to share? Do you, United Way and Envision Center, you or TJ? If TJ's still on here, to talk a minute about the case managers working together.
TJ, if you're here, I hit my unmute button first, so I'm going to let you share. She's going to ignore me.
No, she might be trying to unmute.
Are you referring to the home meeting? Is that what you're referring to?
Yes, to the home meeting. If you want to talk just a minute about the home meeting, and if there are folks here doing case management who want to join that meeting, how they would do that.
We being United Way of Bristol, Tennessee, Virginia, I'm the resource coordinator, and I am Andrea Birchfield. And there are a group of case managers and community agencies that we meet about every 2 weeks, and we discuss and try to come up with resources for those who are homeless, and in trying to provide housing and just some wraparound services with those individuals. We do have one person in the home program, and she came to us because of COVID. She was homeless, got COVID. We were able to quarantine her. And then she stayed at the Salvation Army, and she worked really hard at finding an apartment, and she was awaiting disability. So we were able to wrap some services around her, and she is doing well. She is doing well. So we are real proud of her. And, you know, that is what we do. And I'm sure everyone on this call realizes there is no housing available. And so that is just making it a challenge to help wrap services around those homeless individuals. And I've had several phone calls in the last 2 days, not just from homeless individuals, but from families with children. And there's, you know, and it breaks my heart to tell them I don't have any resources for them. So, but anyways, I'm glad the day center is open, and I have referred several to the day center, and that is good.
Right. And for housing, we do have Sam Ferguson's worked a lot with housing over the past year with our prevention grant. So he does know some of the landlords. He knows, so he can help to the extent he can help, but with trying to help people find housing. So yeah, Brandy.
Andrea, just a quick question. In your daily experience, what are you doing for families that need emergency shelter? Or do you all have funds for hotels? Because I'm not aware of a place that has an emergency family shelter anymore.
You are correct. You are correct. And there are no funds available for hotel. I just talked with a lady this morning. She has twins that are 6. And I recommended churches because that's the only resource I have to share with her for funding other than where she is currently staying. And I asked her if that was an option and she wasn't sure. So, Brandy, I don't have an answer and I'm open to suggestions.
So Andrea,
Well, me too. I didn't have an answer either. And so maybe
Yeah.
Andrea has like this super
No.
secret that I didn't know about. Because I'm seeing that as well.
I promise if I had a super secret and a resource, I would share it with the world.
so Andrea, if she has housing that she might be able to stay in, that's also we have some prevention dollars. It's not a lot, but we have some prevention dollars. So yeah, so and you could work on that today. Sam's working, he's not at the day services. So see if there are options or for see if she qualifies for, and right now our programs are not federal programs, so it means the
Okay.
rules are less.
Okay, great.
So,
Great. Thank you.
yes.
Thank
Yep.
you.
Yep, absolutely.
Dottie?
Yes.
I had a question for Dottie. Your donations page in your presentation, I was wondering, I didn't get to view all of it, but are you taking donations for, I know you said you wanted to implement hot meals soon, so would you be taking donations for, kitchen utensils like pots, pans? No?
No, we are in the Salvation Army building and they have all of that. So we would be using their kitchen resources for
Okay.
hot
Yeah.
meals.
So yes, Erica, though, for people setting up housing for the first time or because they've lost everything.
Okay.
Yes, but we don't have a process for storing that until we have that need. So
Okay.
probably we would ask for that when we have that need.
Okay. Now what about disposables like aluminum foil, cling wrap, gloves? No. Okay. Okay.
Nope. So we're very in our partnership with Salvation Army. They are awesome for what they are working with us and providing. So for things that are used there on site. So, okay. Anybody else have a question or want to add some? I have a couple more things along these lines.
Margaret, this is
Yes.
Jess. I do have a question. You were saying that you had some prevention funding. I realize it's probably limited. Or do you have a geographical limit as to where that is able to be put into?
Tennessee, Virginia, probably Bristol, Tennessee, Virginia, but our grants were limited to Tennessee. This grant, it could be Bristol, Tennessee, Virginia.
The city of Bristol?
Yeah, probably.
No, I just wondered.
Yeah, thank you for asking. And it really is not a whole lot of money, but we have it. And as long as we have it, we have it. And when we don't, we don't. So we don't want to not, keep saving it for a rainy day when it's already storming. So anyway, a couple of things. One, and Andrea will get back with you all to see the best approach. I know having folks dropped off in our community that are coming from other places is an issue. And we just yesterday, apparently people saw a church van from Marion area dropping off people in Cumberland Park. So not dropping them off at even one of the shelters or just dropping them in the park. So trying to figure we have to follow up with that to see what's going on with it. And we know that Bristol is where the services are. Other communities don't have shelters, et cetera. So that makes Bristol attractive for the services from particularly Southwest Virginia, since that funnels down to Bristol. Also, Dottie spoke about Unite Us, but we're realizing how critical that is as we work with folks whose lives are in chaos and they might not remember who's worked with them on an ID or worked with them in different ways. And for us not to have 3 different case management programs going at the same time for the same person. So trying to work with the Unite Us so we can see what each other are doing and where progress is. So we're seeing that as even more critical with serving the folks who are homeless. Also just for resources, I thought Eric Fields might be here today. We have a website, servingtricities.org, that has lots of resources, but it's only as good, just like the community resources in 211. Those we have to put ourselves, our resources into it for it to be help out a lot. Also, Sullivan County Anti-Drug Coalition has a nice little booklet. It focuses on recovery and addiction services, but it also has lots of other resources. For a hard copy book, it's available and we can point you in that direction. And I'm not sure Melanie Eisen was going to be on here, and Rorick. A couple people were going to be on here from SCAD. And United Way's website, they've added a resource page that has some of the most frequently used websites. So, and the other thing I was just going to add is the City of Bristol, the Industrial Development Board, commissioned a study for commercial and multifamily. One of the results of that study, one of the findings is that Bristol has about 2/3 of our housing is single family. And comparing to Johnson City and Kingsport, they're closer to 50%. So we are short on our multifamily housing. So, and then some other things that prompted a discussion on, that was more median income housing, on affordable housing, and where City Council has talked, and we're hoping to expand that study, go back and have the person working on it, Randy Gross, to expand that to affordable housing and do some work along those lines to see how we can bring together our community resources, what incentives we can offer to get some housing. So this is part of our big picture plan that United Way and Chamber of Commerce have come together to facilitate some planning. So I think housing is high on our list to know we absolutely have to have the actual housing. And I think every day we're losing it with more people doing Airbnbs, with people coming into our community, and with more workers looking for housing, particularly with casino workers and folks coming in. And young couple who were at the day center last week had lost their housing. Their landlord sold their property to the casino for the footprint. So there's just a lot of work that we needed anyway, and now just even more critical post-COVID and with the growth of our community. So with that, if we can go around and you can introduce yourself and you have any updates or share, that would be fantastic. And Andrea, you're unmuted. I'll say, go ahead if you have anything more from United Way.
I did want to let you know of United Ways. It's called Reunite Program. And it is for individuals who come here from another area for whatever reason, and the situation doesn't work out, and they want to go back to where they came from, or they want to go home. We, United Way, will fund for a one-way bus ticket. And the process involved is they go to the Salvation Army. Salvation Army will get information from them, verify, because we're not going to just, we are not going to be the community that puts people on a bus and sends them somewhere else without a support system. So we verify, or the Salvation Army verifies the support system for that individual or for that couple. And then United Way will pay for a bus ticket. I have worked with United Way since January, and I would say I've probably done 2. Since last Friday, I've done 5. I've done 5, and that includes a couple. I've done 2 couples and then 2 individuals, and we had one this morning. So just to make you aware of that program, that is from a donor that provided that money to United Way. So I wanted to share with you that. The other piece of information is we do have utility assistance, COVID CARES monies available for utility assistance for those who are financially impacted by COVID. It is only for residents of City of Bristol, Virginia and City of Bristol, Tennessee. So if they've lost their job because of COVID or lost hours because of COVID and need help with utility assistance, they can call United Way, and we'll see what we can do. And that's it.
Thank you, Andrea. And that program with the surge that's going on where people are having to miss work, et cetera, is maybe we'll get an uptick for some of the folks applying for those funds. So, okay, thank you very much. And Susie Peterson that left, she's with United Way of Kingsport, and they are doing their case management through their Salvation Army and working on that. I was hoping she would be able to share, but I didn't move fast enough to ask her to share. Okay, Donna Quillen, I see you next on my screen. Okay, can you unmute?
All right, now.
There you go, great.
Okay. I'm Donna Quillen with ETSU Educational Opportunity Center. It's a TRIO program, and I help students or help people that are wanting to further their education. And I help them with the processes, and it's regardless of where they want to go to college. So if someone needs to get their high set, I can assist with that by providing information on where they can go and providing a study guidebook for them. And we can sometimes pay for some testing fees. And then if they're looking for furthering their education with higher education, whether it's TCAT, a community college, or a university, it does not have to be ETSU. I help them with the admissions, financial aid, ordering transcripts, any of the processes that have to be completed for enrollment in college. And then once they're enrolled in college, I continue to help them up until they have their bachelor's degree, if that's where they want to go. And, I help them with resources to help them be successful as a college student. And I do meet, I serve Sullivan County, but we have advisors that are in Greene County, Hawkins County, and then Johnson City, Carter, Unicoi, and Washington County. And
Great.
so I can send out information to anybody that is interested, and I'll put my information in the chat.
Thank you. That'll be great to have that in your chat. Okay, Courtney Price, you're next. And we picked up COVID tests from Sullivan County Health Department to test everybody who wants to be tested at Salvation Army and Day Center. So we appreciate y'all.
Hello, I'm Courtney Price. I am with the evidence-based home visiting program called Healthy Families of Sullivan County. We are under the Sullivan County Health Department bracket. I am actually located within the Sullivan County Health Department. In my program, we see women that is prenatal with kids up to 5 years of age. We go in and assess their needs, link them to resources, and we also do a lot of developmental tools. And then just be their support person and make sure that their child is developing and getting the shots that they may need. That's about that program. With Sullivan County Health Department, the things that are coming up there is we are starting a Red Sand project, which some of you may know what the Red Sand project is, but it's awareness of human trafficking. We do that next Thursday the one here in Blumfels at 10 a.m., the one in Kingsport's either at 11 or 11:30. And then we're also participating with the homeless point in time survey through the ART. 4 of us is going next Thursday to do that and participate in that. If there's anything that we need to bring Margaret or anybody on here, then I'll see if I can get in touch with anybody. I know through our education department here at the health department, we do offer sanitary things like soaps and toothpastes and stuff. So if I can get some more information on that, I would be happy. We are in the process of doing the Unite Us platform. We're still getting training on how to navigate that. So just be sure to look us up on that for any referrals or anything like that. And last but not least, when you were talking about a place to be shelter, this is for Dottie and Margaret, I was thinking about all the services that the Sullivan County Health Department offers, and I would love to discuss more about a partnership on that platform. I mean, we can enroll teen care patients if they're pregnant. I mean, we do that every day. We can team up with the family planning clinic on any birth control measures, STD clinic, our hepatitis C program. A lot of things that we can team up with and talk to our director of operations about. So I'd like to discuss that more, but I think I'm done.
Thank you very much. And I failed 2 things that you mentioned. Thank you very much. The point in time is next Thursday, and Christina Blevins isn't on here. She would definitely talk about that. So point in time usually is the count for how many folks you have homeless. It's usually, the HUD has it in January, usually the last week when it's the coldest ever. And we all complain about why isn't done in different weather. And somebody had the bright idea of, we can do our own. We do not have to have the official HUD. So let's try one in July, see what we get, see how much difference there is, et cetera. And that can help us understand if there's a big difference, to see if it's similar, then that might be pretty accurate. So we're real excited to be doing that, and that's great. Y'all are participating in that, Courtney. That's fantastic. The other thing that Family Promise, and I think also United Way, there's state health department grants that are related to COVID for being prepared and serving as things are happening right now. We are waiting for our contract to be returned for Family Promise. And so we are going, and it's a state health department grant, and we absolutely want to be partnered with our health department locally for it. So anyway, we're anxious to get it, because you write a grant and say what you're going to do, and then the way that the state works is they send it back and tell you what you are going to do, which sometimes that's what you said and sometimes it's not. So we're anxious to get that grant to see what it is that we're going to be doing. So thank you. That's awesome. So, and thanks for pursuing Unite Us. I know and as we see problems with it or whatever, we need to give feedback, see if they can change things on the platform if they need to, or the process. Nathan Farner, I see you next, and then maybe Joy, if she's still on. I think she might have jumped off.
Oh.
Anyway, you're it.
Excellent. Thank you so much for having us and letting us still a few minutes. My name is Nathan Farner in the Office of Leadership and Civic Engagement at ETSU. And on the call with me is Joy Fulkerson, the Director of Leadership and Civic Engagement here at the university. So hello, Donna, fellow Buccaneer. Excited to be on. Wanted to hop on briefly just to introduce ourselves, hear a little bit about you all, try to build some new connections. Our office, Leadership and Civic Engagement, is essentially the hub for some leadership, community service, volunteer outreach, nonprofit outreach work here at the institution. So we have a variety of different programs our office manages. Volunteer ETSU, which is a service-based student organization that hosts a variety of events throughout the semester that get students out in the community serving. We manage the university's Serve platform in partnership with the United Way of Greater Kingsport. So it's an opportunity, I think some of y'all are familiar with some of those Get Connected platforms where you can identify service locations. So we manage the one here for the university. We also manage what's called our Alternative Breaks programs, which is opportunity for student teams to travel around the country during their traditional breaks from campus, so fall break, summer break, winter break, spring break, to travel to some city remotely and tackle a service issue head on or a social justice issue. So this past semester, we had some folks go to New Orleans to look at education inequality. We had some folks go to Kentucky to look at alcohol and substance abuse. We had folks go to Nashville, a student team go to Nashville that Joy actually led, around health disparities in Tennessee and a variety of other topic areas. So we do those every year. And then a couple of other programs that we manage, some of our voter engagement efforts here at the institution. We manage a scholarship program and some leadership and diversity work as well. But just want to introduce ourselves, let you know that we're a resource here at ETSU. Of course, if you're ever needing volunteers or looking for partnership opportunities, I'm actually dropping our information into the chat, my phone number and email, Joy's as well, and then our generic service opportunities if you're ever just looking for service opportunities. Two that are immediately coming up, though, that I wanted to share with you all that we have some partnership opportunities for. First is on Friday, August 19th from 9 to 11:30 is our preview service plunge. So this is a time where students, new incoming students at the university, first year students, the weekend before classes start back, will go out in the community and volunteer at a variety of different organizations in the Tri-Cities. We have between 700 and 1,000 students to place for that day. So we've got lots of different placements. We've got groups that take 10, 15, 20 people, and we've got groups that take 200. So that's an opportunity if you have any sort of a need that you think our students would be a good match for, whether it be something direct, hands-on, or whether it be something there in the office, you know, putting together bags or resources. We've had students go through warehouses, help organize, clean out, get things together. And, you know, any of that work that maybe you've been putting off that you think students might be able to help you get done, especially in a large group in a short amount of time, definitely let us know. And then also on Tuesday, August 23rd, here on campus, we have what's called the Scoop on Faith and Service. It's a part of our Welcome Week activities, the first week of classes, where students, it's essentially a nonprofit fair. Students are able to go through, learn about some different nonprofits that are in the community, opportunities to volunteer, opportunity for you all to table and do some marketing as well. So if you need volunteers, of course, reach out to us, especially for that August 19th opportunity. And then if you're just looking for a chance to touch base and connect with campus a little more and maybe recruit some students to be volunteers or just to educate on your particular group or area, definitely invite you to participate in the Scoop on Faith and Service. I'm going to drop the links in the chat for both of those to directly sign up if you're interested for the forms. And then Joy, do you have anything you want to add as well?
Yeah, just to add a little bit of context. One, thank you all for having us. I wrote down a number of agency contacts and resources, and really appreciate this sort of hitting lots of people at one time. So thanks for the invitation. Melissa, thanks for that to our staff. Context around the August 19th date, just know that we are transporting students there. So distance will be something we'll need to take into consideration. But we have sent folks over to Second Harvest Food Bank, you know, so if we've got to, you know, if someone were willing to help coordinate even, you know, loading up 50 students to come to Bristol and do a couple of drops, we could probably make something like that happen, because then we would sort of know we would push them out really early enough to get there. And of course, they'll need to get back to campus for the remainder of that program activity. But I think there are some great opportunities. We at the university are seeking to grow and expand our community outreach and community connection. So again, I have not necessarily done that Bristol network as strongly as we need to. So again, I appreciate this invitation and being included in future opportunities to share. Nathan mentioned the ETSU Serves platform. Again, that's a partnership with all three of our regional United Ways, where I think Kingsport's sort of taking lead, but we connect with the Volunteer United site. So would just encourage you to keep those sites updated and posting those service opportunities, whether they're one time or ongoing, because we're then pushing that portal out to our students, encouraging them to have more direct, you know, in real time kind of connection to nonprofits, sort of getting out of the way, if you will, of the middle person. The other thing I would just mention is we also, you know, he mentioned the alternative breaks experiences where we go to different parts of the country, and folks oftentimes say, well, why are you leaving the country, when some of these needs obviously are very prevalent and here in our community. So we also have opportunities to dig deep into some hyper local issues. And I think housing is one of those. And Margaret, I got to hear from your partner around some of the healthcare disparities and in race with our Black-White dialogue community. It was very compelling. And so again, looking for opportunities just to connect in our community and help our students connect in that way as well. So thank you so much for having us.
Good. So yeah, so I hope he did an adequate job with this.
It was great.
With some well-informed people. So good. Excellent. So yeah, let's see what we can do to strengthen those. And also and we're losing some people quickly, but we do have other opportunities through Bristol's Promise in particular. And Melissa, maybe call on you for talking about the other. Well, I can talk about Youth Networking Alliance is one of them that started a lot of our networking, and our next meeting for it is September 22nd, I think, and it's hopefully going to be a hybrid. That's when we hear from our 2 school systems and get updates, but that meets every other month in general and tries to hit a lot of variety of topics. Melissa, do you want to talk about Trauma Informed Care Coalition?
Sure, and my internet's being wonky, so I've had my video off. First of all, Joy and Nathaniel, thank you both so much for being here and for reaching out. Anytime that we can get students involved in community experiences, it's a great thing for our community and for the students, so I appreciate you all taking the time. We do have the Trauma Informed Care Network for the upper 8 counties of Northeast Tennessee, and that meets on the alternate months from the Youth Networking Alliance. So our next meeting for that will be the 4th Thursday in August. And we encourage everybody, it's from 10 a.m. until about 11:30. It is via Zoom because we don't want people from, far reaches. But, what our goal is to create a trauma-informed network across the 8 counties. So, we have students, we have educators, we have all kinds of people, healthcare that show up, business leaders that show up, and we're looking to expand that. So that might be something that your students might want to come to a meeting or 2 just to kind of see what's going on and get involved in that, especially if you have students who are in healthcare or health and human services, social work, those types of things. But really any student can benefit from it.
So good programs with that. And also Southwest Virginia, United Way of Southwest Virginia, Danielle Dye facilitates. Did you already say that and I wasn't listening? No. So yeah, so they have also a program, we coordinate with them as well. So, and they have their coalition that we all try to work together. So we're paralleling each other in the 2 across the state lines. And Brittany, that kind of opens up. Do you want to talk about the Strong ACC for a second and be sure everybody's invited to join that?
Sure. Thanks, Margaret. So my name's Brittany Bowles. I am the community engagement specialist for the Strong Accountable Care Community, which if you're not familiar with us, we are a collective impact coalition serving a 21 county footprint across Northeast Tennessee and Southwest Virginia. And we are really the connective tissue, bringing together diverse sectors and working together to improve the health and well-being of the region. We have a cradle to career continuum. So our initiatives focus around maternal and child health outcomes, improving those, early care and education, and then also middle, high school, post-secondary. We have initiatives across that time frame as well. So I would love to connect with anyone that's not already involved in the Strong ACC. It's very simple to join. It's completely free, and I would love to talk with any of you all that might be interested in learning more. So I'll put my information in the chat. One of the initiatives that we are working on is continuing to build out that Unite Us platform. And I know you all have talked about that several times. And so I'm excited that several of you are already on that referral technology platform. We do offer a monthly Unite Us user training, and the next one is actually next Thursday, July 28th, from 12 to 1, and it's a virtual meeting, and those have been super helpful to the current Unite Us users. We also have an information session coming up for folks that are interested in joining the platform or just in learning more about Unite Us. And that will be in August, August 9th. And so I'll provide more details a little bit closer to time, but that's going to be an in-person session. Thank you.
Thank you, Brittany. Also, two things, and Melissa, you probably have some other things you want to share, but I'll share. Bristol's Promise has a fantastic newsletter, so if you're not signed up for that, you want to be. And a lot of these events go on to the Bristol's Promise calendar. Also, coordinated partner with Strong ACC is Strong Kids that Speedway Children's Charities does, and they're doing maybe, Brittany, quarterly sessions.
Yes.
And those if you sign up with ACC, you'll get that information. It also comes out through Bristol's Promise newsletter and calendar. So just lots of ways to be connected and work together. So okay, Melissa, do you want to add anything more about Bristol's Promise? And then we'll do Brandy and Erica. She may still be having trouble. So Brandy, why don't you go ahead and go?
Yeah, I can jump in. Hi, guys. I'm Brandy. I'm with Bristol's Promise. I'm the program coordinator for the Bristol Connect program, which is a workforce sustainability program that partners with businesses in our area to kind of provide those wraparound resources to those frontline workers that may be struggling with life's ups and downs, right? And also for the program coordinator for the PACEs and trauma-informed care networks as well. Eric and I, it always sounds like I say Eric and I, but I'm saying Erica and I. I'm from a holler and nowhere. It just all runs together, I guess. But we continue to be on site with our partner businesses. We are accepting applications for new businesses. So if you know of a business that really just wants to make the change to take care of their employees and just become better, please let me know. Give me a contact information. And I'll be glad to reach out to them because it's so very important. And I'm getting ready to have my very own Buccaneer. So let's go Bucks, right? She starts in August. So super excited about that.
And connect her with their office for doing a lot of
absolutely. You definitely want her to take over something.
I just have to say, Erica Ashford, who is our newest employee, also starts at ETSU in the fall. So we are just building bucks all over the place.
That's great. I don't know if I need to go to preview or help coordinate.
So I was like, Rihanna got invited to preview. Yeah. I think she could probably help coordinate preview. So
that's good. Well, we'll let her participate and then we'll tap her for leadership for sure. Send them both our way.
Yeah, they both.
And of course, Larissa is one of ours as well. So it was fun to hear her name mentioned early on in the conversation. So thank you.
Right. Yeah. Okay, Erica.
I don't have many updates. Today is my 30-day. That's probably it.
Yeah, she's been with us 30 days now, and today we have our 30-day follow-up. But I will tell you that she has absolutely been through all kinds of rigorous ACEs information and building strong brain stuff. And I mean, she's just learning lots and really just digging her heels in. And I feel like that she is a great asset to our community. And I'm excited to continue working with her because I think she's really going to change the world.
Which that's Brandy's motto, and we sign on with her.
And that's your 30-day review, Erica. We're done.
Thank you.
So yeah, so Bristol's Promise has quite a few programs. So you can check that on the bristolspromise.org. And Joy also referred to DEI, Diversity, Equity, and Inclusion. We are very fortunate to have Tina McDaniel, who has some other personal things going on this week, but she is working in that area, and we're just thrilled not only for our organization and those everybody here, but also for our region, that she's bringing a lot of talent and a lot of ability to help in that area that we have not had people with dedicated job descriptions and time to do as much as we would like to see going on. So that's something we're really proud of. Okay, and let's see, Jessie?
I am Jessie Winship. I'm actually a community health worker with Aetna Better Health of Virginia, one of the MCOs with Virginia Medicaid. But I've worked with multiple organizations. I worked for Valid for 3 years, and then also worked for People Incorporated for about 8 years. So in homeless programs and things like that. So I'm excited to kind of know what's going on again. And but yeah, we said in another meeting, and this has very little to do, but make sure that if you have people that you're stumbling upon that maybe don't have the correct mailing address and they do have Virginia Medicaid, please be very aware that they will be getting their renewal notices for Virginia Medicaid. And it is extremely important for them to submit their renewal information for that, because they are going to be dropping people who do not get those renewal notices in, and they will lose their Medicaid insurance. So just one thing for everybody to be aware of.
Thank you for that reminder. So also we talked about IDs, and most of the people left on here are not working directly, but the Bristol Food Pantry that's been here a long time, part of the qualifying process is you have to show an ID, and you have to show that a copy is made of that on your form, and then you have to show your social security card. But what that means is that when people don't have an ID, a call to Bristol Food Pantry may find an old driver's license that might have some contact information, that might have a good way to start searching for that identification. So just to keep that in mind, that might be a route to shortcut to help people get their identification reestablished. So, okay, and I think, so April, I think that you're the next one.
Hello, my name is April Wilson, and I'm a community health worker for the Virginia Department of Health. And I work with the Mount Rogers Health District. And me and the other CHWs have been setting up resource tables at organizations and events. And so far this month, we have given out a little bit over 300 flyers, and we have trained around 50 people in the Rapid Revive training. And I think that's all I really have today.
So and when you say Rapid Revive, a lot of us call that Narcan training, yes, but it might not be literally Narcan. It depends on what's available, right?
Yeah. Yes.
So fantastic. Also, yeah, so we're the day services also, we have opportunity to work with the Bristol Health Department that's closer than the Sullivan County one. And Courtney, you're still on. We're hoping Bristol lost their health department in the city limits when the new hospital that is no longer new. And we have not had health department services in our community since then. So we are hoping that that's getting closer to bringing those back to our community where they are more accessible to folks with transportation always being an issue. All right, I think we're not bad for what we've covered today. Does anybody else have something that they'd like to add before we sign off? And
I have a question for Jessie. Jessie, do you have a deadline on the assessment or renewal notices for the Virginia Medicaid patients? when that deadline is?
Unfortunately, all I have was a start. So they were going to start doing that in July, with sending those notes. Now, some of the MCOs and some of the Department of Social Services have been doing that since March. So it's becoming an issue. And I was still working for Ballad then, so that's when I knew it started happening. What I would just highly suggest is, if somebody has Virginia Medicaid, because they haven't had to renew these in 2 years. And so if somebody has Virginia Medicaid, I would highly suggest that they contact the DSS office and document, for themselves when they have done that. Because I think it's going to be a staffing issue versus when the state is requiring it, but it's going to be a staffing issue as to when they're actually going to be able to get those renewal notices out. So I don't want to say it's a hard deadline by any means. I don't want to speak for anybody, but I know it's happening. So I would just suggest, if somebody does have Virginia Medicaid, to go ahead and contact their Department of Social Services that they applied with initially. So whether that's City of Bristol, Washington County, and just make sure that they can hopefully talk to a worker, and hopefully make sure that they have their information, at least an address, a mailing address, updated, so they can get that paperwork.
All right, great. Thanks, Jesse.
And Jesse, is there like a flyer or like are they doing any kind of advertisements?
They are in very small area. Like, we got a flyer with Aetna Better Health that if I can get Jo Beth, if I can get one for her, I may be able to send somehow to someone to send it out to the group.
Right.
I may be able to talk to her this evening to try to get that. So like I said, I mean, I'm seeing it. I started seeing it in about March, that some places that did have the capacity to send those renewal notices out there were doing it, but it's not happening to everyone. So I don't want to say like hard line there.
I
Yes,
was thinking if I had like a flyer, I could put it with a partner business. I could drop them, make copies and put it in a partner business so people are aware, because I know a lot of people with that kind of health coverage. So
yes, I know that if you're at some of these resource fairs in Southwest Virginia, Molina has them. We have them if we're set up there. But I'll try to get a copy of that to send out.
That would be great. If you send it back to me, we can include that with.
I will try my best to get a hold of one of those.
That would be great. And that just helps remind. And Andrea, that would be something to share at the home meeting with the folks doing case management there. So, and Erica, you've put up the sign up for newsletter. Also, just a reminder, we'll send out the recording. We send out the chat. And also, I don't do it all the time because it's so many people, but I don't always do blind copy. So you can actually find somebody's email address if you needed to, a short notice that you've seen on here. The other is that Melissa, Erica, or I, we all have, we have the list. So and we have connections in the community. That would go for Brandy as well. We know people. So we certainly, if you are trying to reach somebody doing social services, human services, in our Bristol community, one of us is probably going to be able to connect you with somebody. So just keep that in mind as well. Okay, well, if nobody has anything else, greatly appreciate everybody being here, and appreciate new faces and trying to make connections. Also, I will say Family Promise is doing the Emory and Henry plunge. So we signed up with them, and we think all we can handle is one at this point. So, but it's a great opportunity for nonprofits. It also, I'm sure y'all know, people know, it's so much an equalizer for helping kids work together, as opposed to having a social or having games or whatever. That common goal of service makes such a difference. So thank y'all, and so glad to have you with us. So, all right, so I will see y'all hopefully. Oh, the next one for us is down for August 26th. Bristol Coalition is, as far as I know, August 9th. Lynn was returning her grandbaby to her daughter and son-in-law today, so was unable to attend. Anyway, so our next one is August 26th, Bristol Coalition August 9th, that we do send out those announcements to let people know ahead of, sometimes it's not way ahead of time, but ahead of time. So thank y'all very much, and look forward to meeting with y'all again in about a month. So, and thank you, Dottie, for your presentation and letting everybody know what we're up to at the day services.
My pleasure.
Yep.
Thank you all. Have a great weekend.
Bye.
Take care. Bye-bye.